Hi everybody, welcome to office hours this week. I'm waiting for Erica to join us. Today we're going to be talking about food sensitivities and specifically the LEAP MRT test for that. We're going to talk about who needs a food sensitivity test, a little bit about how we follow the MRT protocol. We're talking about who should not take a food sensitivity test because we don't recommend it for everyone. And we're going to talk a little bit about food sensitivities and how to know if you have them and if you need to be tested for them. So it should be pretty exciting. If you've ever worked with me, you know probably that MRT is one of my favorite things to do for people because we get such good results really quickly for people. Our typical MRT client feels better in just 2 weeks, so that's pretty exciting. You usually feel about 50% better after starting the MRT protocol in just 2 weeks. It does require some really big changes to your diet, so that may or may not be right for you, kind of depending on how you're starting out. Some people need to be careful with overhauling their diet, and some people feel so bad when they start working with us that they're just all in and ready to do anything and everything to feel better. One of the big questions I like to ask before someone does the food sensitivity test and signs up to work on that with us is if there's any food you're not willing to give up for 2 weeks. I say MRT is not right for you because it could require giving up things like caffeine. If you find out that's reactive, it could require giving up alcohol. It could require giving up chocolate, which is another one. Potato chips is a hard one for people. So all sorts of things that you might not want to give up, you might be asked to give up. So just make sure that like part of watching this video is to make sure that it's going to be a good fit for you. So I'm excited to dive into that today. And right before I got on here, I added a sample of MRT test results to the post for this in Facebook Live. MRT, or Oxford, the lab that does the MRT test, is now testing 176 foods and chemicals. So that's a pretty big panel. When I first started, I think it was 150. So they've been kind of slowly adding things over the years. And it's a really good way to get a look at your food sensitivities and what foods are specifically causing inflammation in your body. MRT focuses on inflammation, and it does it in a really unique way. It's Erica's having trouble joining here. Just see what this does. Go that way. There you go. Let's see what it does again. She's trying to connect. So MRT, unlike other food sensitivity tests, is specifically looking for foods in your diet that are contributing to inflammation. And the way that it works is that MRT stands for mediator release test. So it's looking for blood cells, red blood cells, to release mediators when they come into contact with problematic foods. So what it does is if the blood cell shrinks, when it comes into contact, if your blood cell shrinks when it comes into contact with particles of foods that are tested, then it indicates that mediators have been released and those foods are causing inflammation. And other tests are looking more for antibodies, and everyone's going to produce antibodies to foods. So I was just talking about how MRT looks for mediators to be released from cells, and if the cells shrink, then the mediators have been released. And other tests are looking more for antibodies, and anyone who's consumed a food can produce antibodies to the food. So other testing can be more like a glorified food journal, just highlighting what you eat often, where MRT is more specific to what's causing inflammation.
I would agree with that. Something I like to tell people too is um, what this is doing is it's coming all the way back to the cell and it's your actual response. When a lot of times those antibodies that are produced, you can't tell how strong they are if they're, what's actually happening with it. So it's exactly like you said. It's what they've been eating. So a lot of people will come to us saying, "Oh, I've had a food sensitivity test done. I tried doing stuff and it didn't really do anything for me." Yeah.
Yeah, and sometimes it's like, oh, I got this test and I'm supposed to avoid corn and bananas. So they do, but that is not the same at all as doing our protocol.
Yes. I think that's the nice part about it because they're like, okay, I know to avoid these two foods, but now what do I eat? So we have, I would say, a good, better, best sort of protocol. So we fit into where people are willing, where they're motivated. But best case scenario, we just have certain foods that are the least inflammatory for several weeks so it can soothe and calm the immune response and the body can help bring it back into balance. One thing I will note though is people say, well, won't you just get a new food sensitivity now to the foods you're currently eating? And we take the approach of healing the gut and doing the food sensitivity testing. So if you don't heal the gut, if you still have leaky gut, you're going to start to develop new food sensitivities. So, what's kind of been your experience with people and following? Are they able to follow? How do you feel like you guide them if they have a really busy lifestyle?
Yeah, it can be tricky. We always try to qualify clients and kind of like put them in the right program and do the right thing with them. I would say if you are someone who travels a lot, someone who can't give up your favorite food, so if you've had a history of an eating disorder, sometimes it might not be right for you. If you hate cooking, and you're not willing to prepare your own food, forget it. It's not going to work. The way we start people off on the protocol is with your least reactive foods. So we'll give you a list of like 25 to 30 things that you can eat, and you can only eat those things for 2 weeks. And that means that you have to make everything yourself for at least 2 weeks, usually closer to like 6 to 8 weeks. Um, but with that, we've got a really clean scientific experiment going where we're keeping everything else out of the diet unless there's an essential medication situation going on. And you're only eating those foods. And then when we reintroduce foods, which we'll meet every couple weeks to do that, we're adding in one new food at a time. And sometimes it's like one new food every 3 days, depending on the person, especially if you have like migraines or something, it's probably better to go a little slower. Or sometimes it'll be like one new food every day. So it kind of depends on the person, how we want to add those foods back. But I think the most important thing is, being willing to make some pretty big dietary changes to be a good candidate for LEAP, and also being able to prepare your own food.
I think it's one thing that's really interesting too with this is that one food might cause one symptom and another food might cause a different symptom. And people don't even correlate. Most people think, oh, if I get a stomach ache, that food isn't good for me. And that's a whole separate digestive talk. But I've seen people, one food will give a headache, one food will give anxiety, one food will cause fatigue. Another one might cause like skin sort of hives or rashes. So I've noticed some pretty different things like that. How about you?
Yeah, definitely different foods can cause different symptoms. And with food sensitivities, like a symptom can happen, it can happen right away or it can happen up to 3 days
Mm.
after the food's been consumed. So the other thing our clients have to be willing to do is keep a food journal and symptom journal. And if I tell people like I'm pretty hard on that because we really can't help you if we don't know what you're eating and we don't know how you're feeling. That's really key for us is to be able to look at everything to kind of put the pieces together. And another kind of interesting thing, Erica, I think, is when people come in and they've kind of like pigeonholed themselves into eating like 10 foods and everything else makes them feel bad, but they're not able to expand their diet. So, what do you like? What would you do in that situation?
There, there's a lot of coaching that has to go around
Yeah.
that, really, because, yeah, I'm thinking of a specific patient that followed very strict things for 2 years, and it wasn't low FODMAP, it was something completely different. And to like help her understand that it's okay to now test and try this food out. There's a lot that goes into, you'll be thinking about food a lot for at least a period of time. So being able to see it as this food's not causing an inflammatory response. This isn't causing inflammation. Like I said before, it's very different than this food gives me a stomach ache. So sometimes we do have to, like, for example, if a patient, if we know they also have SIBO, we also have to, even though it doesn't cause inflammation based on the blood test, we still might have to limit it because of the types of fiber in that food. So there is more education, there is nuances. So we really do work one-on-one with patients to help them understand and figure out exactly what's going to work best for them. But the cool part is, after you've eliminated those foods for a period of time, you can start having them again. They're not going to cause that inflammatory response. So the whole idea is, yes, in the short term, it's limited, but it's really meant to be able to broaden the types of foods you're having, because that's really important for gut health, for our nutritional status, and everything else too.
Yeah, I think definitely having a lot of diversity in the diet to increase our nutrient intake, to feed the good bacteria in our gut is really key. So I love helping people go from like feeling like they can only eat 10 foods to realizing that, they can actually eat a lot of things. And sometimes having the blood work done for MRT is a really helpful step towards that for people.
Yeah.
So I like using it that way. And I really like that we focus on what you can eat versus what you can't eat. I think it's really hard when someone's given a list of, all these things they cannot have and they don't know what to do. But we're focusing on what you can have. And then the other big part of what we do is helping you figure out what to do with the foods that you have. So the first session, when you meet with us and you're going over your food sensitivity test results, we're explaining the results to you. And we're also helping you come up with meal ideas for breakfast, lunch, and dinner, and snacks, so that these 2 weeks where you're on the restricted diet, you at least know what to do with the foods that you have.
I think that is crucial. And I like that focus much better too. These are the things you can have. And it's still about balance. So it's not, oh, I can only have the protein. We're really trying to balance macros at the same time to give that well-balanced meal for sure. Um, who would you say would benefit from this test?
Oh man, I think anyone with any sort of like inflammatory disorder, anything ending in itis, I think is great. I've had a lot of success with it for eczema, IBS, IBD, migraines. It works pretty well for. I like with migraines. I like pairing this with the Nutrival, and really digging in on magnesium. Um, yeah, what am I missing? Yeah, any sort of like skin condition, anything where the immune system is overreacting, this really helps to calm it down.
Hmm. Usually a side effect is some weight loss if you're looking for weight loss. Because if you think about that, weight loss resistance has to do with just constant low grade inflammation in the body. So anytime we see somebody with leaky gut, that's a really great candidate because they likely have food sensitivities. We also have markers on the stool test that show inflammatory and immune response. So that is a good indicator for us of who would be good for that. um, People that just have a lot of pain, um, they're on a lot of medications, pretty much honestly, everybody could benefit from it if you want to look at it from like a longevity or optimization standpoint as well. So my whole family has gone through it. I'm not sure if your has or not, but
Yeah, three
um,
out
Yeah.
of four of us have gone through it, and we've all seen huge improvements from it.
Yeah, I do want to share Marin's story a little bit.
Mm-hmm.
She's my type 1 diabetic, and she was diagnosed at 9. She's 17 now, and she was just having um, lots of headaches, lots of pain, lots of digestive upset, and our endocrinologists are great and they helped us with managing the medication, but they couldn't seem to understand what was going on besides that. And I was getting worried about additional autoimmune conditions and everything. So we did the MRT and it was phenomenal what we saw. Well, here's the other piece. I'm really analytical. So she'd have a food or like the same amount of carbohydrate and the same amount of protein, same amount of fat, and her spikes would change. She'd need different insulin levels for different food or for the same macro, and I couldn't quite understand it. And then when we did the food sensitivity testing, it completely clicked because she went from, I'll give you a number. Let's say she was using 40 units of insulin a day. She cut it to 20 units of insulin, eating the same macros. So what that
That's
means, I
crazy.
I
It's so
know.
crazy.
I mean, you never hear of a type 1 cutting down on their insulin needs. It's always them going
Yeah,
up because
of
they
course.
become more resistant and everything. So the fact that her insulin needs were cut in half, you don't want excess insulin floating in the system. It triggers different responses to store fat and signal different inflammatory responses, actually. So that was a huge win for us. And she has felt so much better since doing it. Now, I will say the results get old
Yeah.
after 6 months to a year. So how often do you recommend people retest for it?
I would say if you're feeling well and you're healthy and everything is fine, you don't need to do it. But like, let's say you worked with us a couple years ago, felt great on MRT, and you just want to do something to like get back on track. You could definitely retest. And like you said, the results are good for 6 months because that's how long the immune system kind of keeps things in its memory. So we recommend after 6 months you get another test. But I mean, don't get another test if you're feeling well. I don't think you need to do that. I think if you have like, things going on that don't feel great and you can't figure out what's causing them, then it's a good time.
It's been interesting because I've had several people retest, even Marin, my oldest daughter's retested. And it was so cool to see the reds come down to yellows and the yellows come down to greens. So it
Yeah.
actually showed the change in immune response to these foods. And so just think about that. Like inflammation is the stem of every sort of disease symptom, absolutely
Yeah.
everything. So if you could find a way, you had just an absolute roadmap for yourself to follow to bring inflammation down. I think that's huge. I mean, we eat every day, so it's not something that we can avoid. We're coming into contact with it. And if you're eating an inflammatory food, you're just causing that low grade inflammation in your body all the time. So,
Yeah.
yeah, I think the test is powerful in that way.
It's really amazing. Like it is such a powerful test just to be able to decrease inflammation in the body. When you do that, I mean, the immune system calms down, which is why Marin's results went from red to yellow and probably yellow to green. And some of the higher greens probably scaled back some. Um, but when the immune system can calm down and it's not constantly putting out these like inflammation fires, your body can actually do what it needs to do to heal and to regenerate. And that is so powerful. And this is your body doing it all by itself. You're just eliminating the foods that are causing inflammation.
Right. I will say, like you said earlier, it's not the easiest thing to do. One of the reds on mine was actually black pepper.
That's
And,
hard.
I mean, unless you're cooking for yourself, it's probably in almost everything. There are a couple others that I think the other thing that is great about this is it creates awareness for people because you have to look at every label. You're actually now seeing what's in your foods that you just really didn't think before. You looked maybe at the front marketing and it
Mhm.
said, oh, it's, gluten-free, it's this, it's that, all these healthy things. And then when you go down the ingredient list, it's a whole new way of looking at food.
It was so eye-opening the first time, this. The first time I ever did it was with my husband, Blake, when he had acid reflux. No one could figure it out. It's a very long story. It's all covered in our webinar, which you can just drop a comment in here if you want to link to that and hear the whole thing. But yeah, so I was doing this to help his acid reflux, and it took me, so I went shopping this list of like 25 or 30 foods, but they have to be single ingredient foods. And I was a graduate student studying nutrition. So I'm getting my master's in nutrition. I get this list of 25 or 30 foods. I head to the grocery store and I'm like, wait a minute, like this single ingredient, like, okay. So I get out of the produce aisle and realize there's really nothing, like not much besides just plain meat, which even like ground turkey apparently always has rosemary in it. There's just all these nuances, like, nuts and seeds. A lot of them have sunflower oil. If you can't have sunflower, like that's out. It took me 2 hours to get through the grocery store as a nutrition graduate student trying to shop for this diet. So to help our clients out, we have an Amazon store with like LEAP friendly products, which I think is really cool. And we have some things we need to add to that too. But yeah, it's really like, it's so crazy how much stuff is in our food supply. I couldn't believe it. I kept picking things up, putting them back. Like, it was so eye opening. It's changed the way we eat completely.
Yeah, I would definitely agree with that. You're right. And I like being able to point those little things out to patients of rosemary is a natural preservative in so many of the healthier foods, and you would never think of that. So it is important to look at all the fillers, all the things that get added. And we were just talking about fake meat at our conference, or goof. What was that? Meat goo or meat glue.
Oh yeah, meat. No, it was Miku. Yeah,
That, yeah. So in the processing, that's always, I don't want to get off way on a tangent, but in the processing of food, they don't have to necessarily share what they used in the process. Um,
disgusting.
I know it's pretty bad.
Makes me just want to eat at home all the time.
I agree. Well, if corn or soybean shows up, those are in, so many things. But again, we have great resources. You
Yeah.
did a whole blog post on just the corn piece component of it.
Yeah, and that makes me think too, like we don't want to forget to tell people to check their medications and check their supplements because, oh my goodness, like corn is everywhere. Sometimes people need to have their medications compounded, especially if they're like a really high reactive to corn. That's a really interesting one. The other thing too that the MRT does that I don't think any of the other tests are doing is looking at chemicals.
Yeah, chemical. I think some have just a few, but again, it's not the same process of how we test the foods. So I think that's a little bit different. But some of the ones that are interesting are things like tyramine, because it naturally builds up in foods as they are leftovers,
Yeah,
or if they're canned or processed. So there has to be this whole new awareness piece for certain people that they could be high tyramine, but it's not even on a food list, for example.
yeah, or like if you notice that someone is really reactive to ibuprofen but not acetaminophen, then you just
Yeah.
might switch up like the medication that you're using if you have a headache or something like that. We test some artificial sweeteners. Caffeine is tested for people. Yeah, we've got some food dyes and colorings to bring awareness to people. Like, it could be in your toothpaste or it could be in your mouthwash, or, blue food dye is probably in your medication, or that little red, like one time a colleague had someone that was so reactive to red food dye that she had to scrape the red, like, stamp off of her pills.
Oh my goodness.
Yeah, like with her fingernail, before she took the pill, she would have to get the red stamp off before she could take it, or else she would have a headache.
What I find interesting is there's also a lot of correlation with ADHD
Yeah,
and food dyes. So like that can also change. So that'd be another type of a patient I think would be great for it. So yeah.
yeah, that's a really, really interesting one too. But yeah, there's all sorts of ways we can use the test results. Like Erica was saying earlier, we can do it at different levels, kind of depending on where the person's at and what you're able to do. I mean, sometimes instead of going through the really specific, like 8-week protocol, you might even get good test results or good results from just taking out the yellows and the reds.
Right. We try to fit everybody's lifestyle or moderate or, change it enough. But we do work with each person too to help build that meal. So I won't lie, like there are definitely times where people feel a bit overwhelmed when they
Yeah.
see those results, but that's why we take that time to walk through and here's how you could build a breakfast. And we've gone through with so many people, how do I find a bread that just has this one ingredient? There are a lot out there, you'd be surprised.
Yeah.
And it's just, and we have the experience with it so we can help.
Yeah, absolutely. And I think it's fun. I mean, I don't love meal planning as a dietitian, but I do like helping people figure out what they can do with their LEAP foods. I think it's just more interesting and fun and like a good time for everyone to get creative.
Same.
Yeah. Okay, so key takeaways from today. I like MRT for inflammatory conditions. Any sort of GI issues is usually helpful. And like you were talking about, Marin, like any sort of autoimmune condition, it can be really, really, really helpful.
hmm Yeah, I would add anybody with pain,
Yeah.
migraines,
Oh,
that sort of
arthritis. Yeah.
thing.
hmm Not good for picky eaters, people who are really busy traveling, history of eating disorders. Um, can't give up your favorite food. Not good for those people. It is hard. I will say the emotional aspect of doing MRT and having to give up your favorite foods is hard. And for me, it was like I didn't realize how much I I don't really care about the food, but I like pairing certain drinks with certain things or having certain drinks at certain times of the day. You know, like coffee in the morning, kombucha with lunch, and I don't know, maybe tea in the evening. Like that for me was like the most difficult. What was the hardest thing you had to give up?
Um, honestly, it was like the cayenne, it was the spices. Those were all high for me, and I love spicy
Oh,
food.
really? Oh,
So,
yeah, you do.
yeah, I do. So that was the hardest because I felt like I had very bland foods to begin with. So I just had to like use new spices, and it is a time to also explore if you do enjoy cooking of now how can I be creative and expand, what I do. So you can switch it and always see it as a positive thing.
Yeah. Yeah, it can be fun. Definitely an adventure. And I feel like the big difference between our test and the other tests is ours are focusing specifically on foods that cause inflammation. It's not going to be a history of just what you've been eating because it's antibody testing. And I think that support that we provide and the level at which we provide it and our experience is really what sets us apart when using the MRT.
I always like it as an add-on to the other things we're doing because of what it is doing to the body. By bringing down that inflammation, it's allowing the body to rest and refocus on other areas of
Yeah.
healing. So I find like we get faster results when we pair that with some other process or other thing we're doing.
Yeah, I agree.
hmm
Cool. Well, sample results are below if you guys want to take a look at that. We'll also link them in this when we put it on YouTube. Yeah, if you have any questions, you can drop them in the comment box. And we will be back next week for more office hours. Thanks, everybody.
Yep, thanks.
Bye, Erica.
Bye.